getting insight on the rapidly changing coronavirus pandemic from the medical experts in Boston. We're joined by Dr. Daniel Koritskis, Chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Thanks for being here with us tonight. The governor keeps talking about expanded testing as being a key for reopening, but we haven't really seen a huge growth in tests being performed. So what is the process? Can anyone get a test, and who is getting them?
We've really expanded the types of people and the numbers of people who are appropriate to get tested and have the ability to be tested now, including even contacts of individuals who've come down with coronavirus, even if the contacts themselves don't have any symptoms. And that's really key here, because if we're going to be able to do contact tracing to contain any little blips in the epidemic that occur as we open up, that's exactly the kind of testing we want to have in place.
But as of now, though, it has to be one of those categories. You can't just walk in and get a test because you want one.
That's right. You really need to fit into one of these categories. That's because we still have limited supplies, not just the tests, but also the swabs or the personal protective equipment that the people obtaining the test sample need to be wearing, and all of that folds together.
Right, of course. All right. So in the last week, the number of people actively quarantined in the state, maybe because, as you said, they were in contact with someone who's positive, that number has doubled to more than 20,000, partly because of that contact tracing. But it's the largest number we've seen so far. Is that a concern as we move toward reopening?
I think it does provide a bit of a cautionary note about why we want to go slowly, as the governor has said. But it's encouraging that we're identifying these individuals. And we have to keep in perspective that overall, the total number of cases, the people in the hospital with COVID-19 across the state has really been on the decline for the last 2 weeks, which is great.
That's a good indication there. Okay, so this caught our eye. We wanted to get your take on it. Health officials in Spain have done large-scale antibody testing. They've now concluded that there's no herd immunity in that country. So what does that mean? And if the same were true here, how do you move forward with loosening restrictions?
I think it's not a surprise that there isn't herd immunity. It shows you what a good job we've done with social distancing at protecting the large majority of the population from becoming infected with COVID-19. But that then goes hand in hand with the need to do contact tracing and testing of any cases that are identified. We can't wait for 60 or 70% of the population to become infected, nor would we want to see that happen. We have to open up gradually in a way that allows us to keep tabs on who is coming out as being infected and who are their contacts, so that we can get them into isolation or quarantine to protect everybody else, and then we'll be able to see the economy revive.
Work with the reality that we have. All right, one last question, Doctor. The COVID-19, it was initially described as a respiratory illness, but it seems there's a lot of vascular symptoms now in adults and kids. Is there any more thought or any more research that this could be more of a vascular illness? And would that change who is at risk?
I don't think this is a vascular illness in the sense that the virus is infecting blood vessels, but we do know that with certain respiratory viruses and with certain other kinds of infections, there are autoimmune phenomena. That is, the body's immune response against the virus attacks normally healthy cells and causes these kinds of manifestations. We don't yet know enough about what predisposes somebody to have some of these more systemic manifestations of COVID-19 and how we might prevent them.
So a lot to watch still. All right, we appreciate your insight as we're all watching it. Thanks once again for being with us, Dr. Koritskis, Brigham and Women's Hospital.
Always a pleasure, Emily.